frequently asked in the NEET PG MDS entrance exams for MDS entrance. So, and in the various public service commissions of the different states, I was focusing upon the most frequently asked multiple choice questions, and 30 MCQs in the previous video of part 1 I have discussed. In succession to that video, now I'm going to focus upon the upcoming, the next 30 important videos, next 30 important multiple choice questions, that is the one-liners, which can be asked from you in the form of multiple choice questions. So students, beginning with, do remember the first most important question what they ask is from the if it is from the NOLA stage. So do remember, according to NOLA stage of tooth, according to NOLA stage, tooth shows eruptive movements at the stage 6. So do remember, out of the NOLA stages, that is the 9-10 stages of NOLAs are there. Stage 0, 1, absence of crypt, presence of crypt. So all such stages are there. Kindly go and check for the NOLA stages. And according to NOLA stage, the tooth shows eruptive movements at the stage 6. All right. Now, if they are asking you the next important MCQ, what can be asked is the correct film series radiograph is the 8 film series radiograph. Next, very important, if it is pedodontics, they ask you Diagnodent uses what kind of laser fluorescence? It is the infrared laser fluorescence. Wavelength is ranging from 650 nanometers. So if it is an infrared light, the laser fluorescence what is seen in Diagnodent is 650 nanometers of laser infrared light the Diagnodent is using. Now, the most important MCQ next is the non-caloric sugar substitutes. So they'll be giving you 4 options, and out of them you will be asked to select which of the following is a non-caloric sugar substitute. So the options can be the saccharin and the aspartame. You're going to tick. Next is the, if it is different books nowadays, it is having different references, but according to the old traditional what most of the books are writing, if it is a small pea-sized fluoride toothpaste, it contains how many milligrams of fluoride? If it in the options it is given 250 milligram, so you'll be going for the 250 milligram option. Now the next important question what can be framed is, that is the ethetosis and the chorioethetosis is seen in dyskinetic cerebral palsy. So in dyskinetic cerebral palsy, what we can find is the ethetosis and the chorioethetosis can be seen. Now when we look at the chemomechanical caries removal, so you must have read in pediatric dentistry, the chemomechanical caries removal involves the use of K-resolve. So if it is K-resolve, what are the constituents of K-resolve? The K-resolve include the leucine, the lysine, and the glutamic acid. So K-resolve is comprising of these 3 amino acids. Next, the routes which are most titrable are the inhalational and the intravenous route. So students, do remember, titration is the method where we can adjust the amount of dosage what is administered to the patient. So when it comes to pediatric dentistry, when it is either it be the conscious sedation or any of the drugs what can be used as a sedative in pediatric patients. So the most favorable routes, the routes which are most titrable are either it is the inhalational route which can be titrated, or it can be intravenous route. Now moving on to the next MCQ is that the ideal age for intervention in Prusenski, that is the type 1 deformity, it is deferred till maturity. Now, moving on to the next important MCQ, the central profilometer is used for the surface profiling and topography of teeth. So these 2 are the very rarely asked MCQs, but still you should have knowledge of these things. Moving on, the next important question what can be asked from the cleft lip and cleft palate cases, it is the lowest incidence of cleft lip and cleft palate is seen in Negroes. Do remember, this is a very important multiple choice question. If it is they are going to ask you, so they'll be mostly focusing on the masses which are having the least incidences of cleft lip and cleft palate. It is seen in Negroes. Now moving on, that is the mass spectrometry is used for protein and body fluids analysis. Now the next important MCQ what they mostly ask is, that is the causes of true anodontia. So anodontia, the causes of true anodontia, if they are asking you on a genetic level, so the answer will go for the polygenic inheritance. So causes of true anodontia is polygenic inheritance. Next important MCQ, it is the according in the behavior management chapter, they ask you the reinforcement technique is based on the Skinner's operant conditioning theory, that is the Skinner's theory. So the reinforcement technique, that the Skinner's operant conditioning theory, that is the positive reinforcement, the negative reinforcement, omission and punishment. So this reinforcement technique is based on the Skinner's operant conditioning theory. Moving on to the next important MCQ, that is the rampant caries. The number of lesions, carious lesions in rampant caries is 10 or more lesions per year. Now moving on to the next important question, that is what is the dimension of rubber dam what is used in children? Very important. I'm making a star over here. Do remember the most important dimensions of rubber dam what is used in children, it is the 5 by 5-inch rubber dam. So now moving on to the next important MCQ, that is we'll focus on what is known as the arch criminal. So students, do remember they'll be giving you 4 sugars, and out of which they'll be asking you the arch criminal of caries is sucrose. Now, the next important MCQ is the indication of strip crown in pediatric patients. Since I'm taking a pediatric dentistry, the periodontics, so indication of strip crown in pediatric patients is extensive caries in anterior teeth. Now, the next important MCQ is the type of laser used in pulpotomy procedure is the neodymium yttrium aluminum garnet laser, that is the ND-YAG laser. Do remember the type of laser what is used in pulpotomy procedure, it is the ND-YAG laser, that is the neodymium yttrium aluminum garnet laser is used for the pulpotomy procedure. Now the next important MCQ what they can ask you is the injury to primary teeth occur mostly at around the ages of 1.5 years. So if they're giving you 3-4 options over there, 6 months, 1 year, 1.5 years, 3 years, so if in the options is the most preferable answer will be of yours will be 1.5 years. Now moving on to the next important MCQ, it is the X articulation of teeth means avulsion. All right, next, the next MCQ is the contusion results from blunt trauma. Students, do remember whenever it is a blunt trauma, it is referred to as contusion. Now the next important MCQ is source of calcium in dentinal bridge is blood. Do remember it is very important, either when in indirect pulp capping or wherever that calcium hydroxide you are going to use as a pulp capping agent, the calcium is never going to come from the calcium hydroxide, it comes from the blood. The source of calcium in dentinal bridge what is formed in pulp capping, the calcium comes from the blood. All right, now moving on to the next important, the fluoride in any form is contraindicated in cases of chronic renal failure. So students, do remember fluoride in any form is contraindicated in cases of chronic renal failure. Root completion, when they are asking you about the root completion in primary teeth, is by the age of 3 to 4 years. Do remember, when it comes to the primary dentition, the root completion of the entire primary dentition, it ranges from the ages of around 3 to 4 years. Moving on to the next important multiple choice question, that is the delayed eruption of deciduous teeth is known as dentitia tarda. Do remember that the technical term what is being describing that is the delayed eruption of deciduous dentition is known as dentitia tarda. Do remember it is called as dentitia tarda. Next important MCQ is the parrot-like speech. So parrot-like speech is seen in cases of autism. So autistic children mostly show the parrot-like speech. The next important MCQ is the interproximal plaque pH drops in 120 minutes or 2 hours. Do remember, you must have heard about the Stephen's curve, and in you can go to the chapter of dental caries and there you can find that an interproximal plaque pH drops in around 120 minutes or 2 hours. The next important question is the MCQ. What they can ask is veracity. What do you mean by veracity? So veracity means truthfulness. Now, the next important question, what they ask you is about the computer controlled local anesthesia delivery system, that is the CC-LADS, computer controlled local anesthesia delivery system. It is known by the name of WAND. So do remember, and another very important multiple choice question, they can ask you the computer controlled local anesthesia delivery system, that is the CC-LADS, is known as WAND. Now, the next important MCQ, what is frequently asked is the Lesch-Nahen syndrome. So, Lesch-Nahen syndrome is associated with the masochistic behavior of children, which are self-mutilating habits. So, the masochistic behavior of children, it is the syndrome. What is associated to it is the Lesch-Nahen syndrome. Now, do you remember, next important is from the space maintainers. So, space maintainers, what do we find is distal shoe space maintainer should be 1 mm below the mesial marginal ridge in an unerupted first molar. So, do remember, that is the distal shoe space maintainer should be around 1 mm below the mesial marginal ridge in unerupted first molar. Next is the Keyes triad. So Keyes triad is given in relation to the dental caries. Now moving on to the next important MCQ, that is xenophobia. So xenophobia, it is the fear of animals. Next we move on to the bite wing film in deciduous teeth. Do remember, they can ask you about the size of the bite wing film in deciduous teeth. So the size of the bite wing film in deciduous teeth is size 0. Now the recommended brushing time in children in direct supervision of parents is round about 1 minute. So they can ask you in multiple choice questions, what is the approximate time for which the brushing techniques is recommended for children in parent supervision. So do remember, the brushing time for children should in parent supervision should be around 1 minute. Moving on to the next important MCQ, it is the finish line of stainless steel crown is feather edge or the knife edge, or it is feather edge in young patients. So student, this was the next important MCQ. Moving on to the next important MCQs, I'll be focusing on what is the KRI paste. So students, do remember, the KRI paste is comprising of the iodoform, the camphor, and the parachlorophenol. Now, the next important MCQ, the MCQ number 70, the reconstruction papilla. Do remember, this can also be a question from the perio. If it is from periodontics, this question can be put up to you in perio as well. That is, the reconstruction papilla is found approximately 1 mm below the free gingiva, lingual to the mandibular canine. So do remember, the site of the reconstruction papilla is found approximately 1 mm below the free gingiva, lingual to the mandibular canine. Next important MCQ, it is again related to the reconstruction papilla. So reconstruction papilla occur in 85% of the children. So what is the incidence of finding reconstruction papilla in children is, reconstruction papilla occurs in about 85% of children, and it apparently decreases with age. The next important question is the critical pH. So do remember, very, very important. We are looking at the critical pH at which the demineralization starts is about from 5.2 to 5.5. You must be very well aware that 5.5, it is called as the critical pH. So the pH at which the demineralization starts is about from 5.2 to 5.5, that is the critical pH. The next very important questions when they're asking you about the trace elements. So the trace elements which increase the caries incidence is selenium, lead, and barium. So selenium, lead, and barium, these are the elements which are going to cause an increase in the caries incidence. The next important MCQ, what they can ask on trace elements is the trace elements which has a protective effect against caries is the molybdenum and the vanadium. So they can ask you very many these transition elements, they can ask you in multiple choice questions. And the trace elements what are responsible, which is having a caries protective effect, it is the molybdenum and the vanadium, whereas selenium, lead and barium are having and elements which increase the caries incidence. Moving on to the 75th MCQ. This 75th MCQ is dentistry for adolescents. The dentistry for adolescents is known as e-febo, and the widely used drug for conscious sedation is chloral hydrate. So in the options they are providing you so many drugs. So nowadays, although there's nitrous oxide oxygen inhalation sedation is there, but the widely used drug for conscious sedation, this text, most of the text they mentioned, this is the chloral hydrate. So this is chloral hydrate. This is not N2O, this is chloral hydrate, that is H2O. The teeth least commonly involved in nursing bottle caries. This is again a very important viva question, as well as in multiple choice question they can ask you. It is the mandibular incisors and teeth most commonly involved in nursing bottle caries. It is the maxillary incisors. So the least commonly teeth what are involved in nursing bottle caries is the mandibular incisors, and the most commonly involved teeth what are seen in nursing bottle caries is the maxillary incisors. So breastfeeding should be stopped at the age of about 1.5 years. Very, very important MCQ. They can ask you in a multiple choice question at what age the mother should be advised to stop breastfeeding. So should be stopped by the age of 1.5 years. Moving on to the next, the last, that is the 80th MCQ, breastfeeding Q. I'll be finishing up the video on this. The smallest primary teeth is the lower central incisor. All right, so students, this was again a 50, more or less I have discussed from around 30 to more than 50 MCQs I have discussed in this video, and the upcoming videos I'll be in the next video, part 3 of it. I'll be discussing the upcoming more MCQs on pediatric dentistry, and I'll be covering up. So stay connected, and students who are new, haven't subscribed, go do subscribe my channel. And if you have any queries or comments in pediatric dentistry, you are most welcome to comment me in the comment section. Thank you for watching.